while there have been huge advances in medicine, HIV still exists. The CDC says about 50,000 people get infected with HIV every single year. Now, to put all of this in perspective, Dr. Aimee Lopes from Sharp-Rees Stealy. Doctor, thank you so much for being here.
You're welcome. Thanks for having me.
You know, I remember Magic Johnson back in the early 90s when he made his announcement. The Lakers were my hometown team. I was shocked, but a lot of things have changed since then.
They absolutely have. That was back in the late 80s. Now there's medications that we use to treat people. People live normal, long, healthy lives. But it's really important to know that people need to get tested, become aware of their status so they can get into treatment.
And here in San Diego County, how many people currently are dealing with HIV?
Roughly about 20,000 people probably here in San Diego County. We have 50,000 new infections every year, as you mentioned, in this country. And about, unfortunately, 1 in 8 of those people don't even know they have the diagnosis, which lends to them transmitting it more to other people. So anything that brings more attention and raises the awareness about the importance of this disease still existing is very important.
And Councilman Todd Gloria, he tweeted after the Charlie Sheen announcement, and he used the hashtag #EndTheStigma. Is there still a stigma surrounding HIV and AIDS?
It's a good question. There is, and it's sad, but it does exist. There's a lot of discrimination. There's a lot of negative connotation about having a diagnosis of HIV. And a lot of this comes from fear, and I'm afraid that fear actually lends to people not wanting to get tested to find out if they are positive, or if they are tested and they are positive, they're afraid to get treatment because they don't want to embrace that stigma that does exist. So it does indeed.
And what are the biggest myths that still exist regarding HIV/AIDS?
Well, there's a lot of myths. One myth is that you can get it through casual contact just by being around somebody with HIV, perhaps sharing a drinking glass, or by touching or sharing a towel at the gym, which is not true. It's not transmitted through casual contact at all. Also, another myth that is common is people think it's a death sentence, that, oh, if I have HIV, I'm going to die, and that's not true. We have wonderful doctors and fantastic medications that are used to treat people so that they can live normal, healthy lives.
Doctors including yourself?
Of course.
And you know, with big names speaking about this disease, we have Magic Johnson, of course, Charlie Sheen now. How does this help bring awareness?
Well, we're having this conversation here, Melissa. I think that's really important. I think the fact that it's on the top of Yahoo News, Google News, in the newspaper, people are reading about it. It brings to the forefront that HIV still exists. People Google it, they talk about it on social media, which is so important about raising awareness. Getting people tested, knowing their status and getting them tested is the most important thing. We want to eventually get to a point where there are 0 new infections. How do we do that? Through prevention. We can only use our prevention strategies if people are aware that they need to get tested and educated. So using this format to educate people is so important.
And lastly, what kind of resources are available here locally for people wanting to learn more?
There's resources online. There's community centers such as the LGBT Center. They offer a lot of community services. UC San Diego has a strong program in promoting early testing for anybody who anonymously wants to get tested. Every healthcare institution has providers that are well-versed in HIV as well. So there's lots and lots of resources for people here in San Diego.
Great. Thank you so much for being here. I really appreciate you putting all of that in perspective.
Thank you so much.
Thanks. We'll shake hands
Thank you.
here. I'm Melissa Mecija with 10 News. I'll be back next week.